Healthcare systems overwhelmed, nurses exhausted, and the pandemic adding to a growing nursing shortage. The night team's John Paul Barajas spoke to a student who wants to be a nurse and a dean of nursing school to find out what their field would look like going forward.
Too many patients, not enough staff. Nurses are feeling the brunt of COVID cases surging, leading many to quit. A medical assistant who just applied to nursing school is witnessing it firsthand. She says pop-up clinics are brutal. The days, long, little to no breaks, and fully decked out in PPE while outside in the heat.
You start to feel faint and you start to feel sick. I've seen some of the older nurses actually sit down and almost pass out because they're so tired. And for that reason, a lot of them already left and resigned.
Marina Moreno explains even she, who's just a year into the medical field, is having to take a break. The days are tough, but her biggest concern is the Delta variant. She adds her own coworkers are getting infected more than she's ever seen.
I have a family of my own that I care about, and I've put them off for the past year so I could help other people. And I think it's about time for a little bit until I move by myself again.
A Texas Center for Nursing Workforce study showed a projected shortage of 57,000 nurses by the year 2032, and that was before the pandemic. An associate dean for UT Health San Antonio's nursing school says, fortunately, applications have doubled since last year, and nursing students are already getting in on the fight against COVID.
Our nursing students were really pivotal in being able to administer those vaccines and help with that mass vaccination effort.
Cynthia O'Neill says within the first month of the course, students are already caring for patients. It's a 2-year program, and currently they have a graduation rate of about 92%, a percentage Moreno soon hopes to add to.
That was John Paul Barajas reporting. As hospitals become overwhelmed, Governor Greg Abbott says the state will be using staffing agencies to get out-of-state medical workers to help hospitals in Texas. It comes weeks after the governor said Texas mastered the safe practices that help to prevent and avoid the spread of COVID-19.